Throughout human history, perhaps the greatest foe against our survival has been something microscopic in size but utterly massive in life's claim: the virus. From smallpox originating in prehistoric times to modern day COVID 19, diseases spread by viruses, some as small as a few nanometers, have caused untold amounts of death. However, thanks to modern medicine, we have concocted an almost magical remedy to deter the worst of these infectious disease spreaders: the vaccine. Perhaps saving as many lives as one claimed, the COVID 19 vaccine, for instance, saved us from a near apocalyptic scenario. But one of the more absurd obsessions of the political far right in modern times is jeopardizing our collective ability to stave off this needless death, simply because some of us refuse to partake in safe, routine vaccination. As seen in the most recent immunization data collected in Hamilton County, anti-vaccination among the general population has grown here, with our school children becoming some of the least vaccinated in all of Tennessee. While the reason we find ourselves here can be attributed to poor individual decisions from parents, this is equally as much as a collective political problem, one exacerbated by the GOP supermajority in Tennessee's state legislature. In 2023, the legislature passed the Mature Minor Doctrine Clarification Act, which prohibits a child from being vaccinated without parental consent. The law also bars the Tennessee Department of Children's Services from mandating children in state custody be immunized. With anti-vaccine activist RFK as HHS secretary, the anti-vaccination movement has, at the federal level, become institutional. In recent weeks, RFK has purged the leadership of the Centers for Disease Control and Prevention, primarily over RFK's absurd vaccine policy. This anti-science, anti-social movement in the upper echelons of power within the Republican Party is ensuring that diseases we tamed decades ago will reemerge and result in needless death. The GOP is taking us back to a time when we were far more vulnerable to these tiny viruses. This time, it is not due to a lack of medical advancement, but due to lies peddled by those charged with protecting public health, due to the mass prevalence of ignorance and fear.